Good morning, everybody. I'm Glen Badger, and this is my beautiful wife, Kristy, and welcome to Community Corner. Kristy and I were lucky enough recently to have an op-ed that we wrote published in not only the state's largest newspaper, but a few other ones as well. And it touches a little bit on some of the things that we need to be cognizant of moving forward to keep our older adults and seniors safe in long-term care throughout our state.
We all know that the residents and staff in our state and nation's long-term care communities have suffered disproportionately from the effects of this virus. Our intent is to focus as much attention as possible on understanding why this happened and identifying the short and long-term solutions.
We're going to post a link to the op-ed in the comments section of this video, and we hope that you'll consider reading it, sharing it with all of your friends on social media and beyond.
The tragic effects of this pandemic cannot and must not be forgotten. We have to educate ourselves and others, contact our elected officials, and urge them to prioritize the protection and care for our elders. The contact information for our elected officials is also included in the description below in the video. Thank you for standing up and speaking out.
Before we touch briefly on some of the contributing factors to the virus's effect on long-term care facilities, we'd like to share a bit of perspective. New Hampshire has no doubt suffered greatly, but fortunately not as much as some other states in loss of life and total number of cases. Indeed, and during this global pandemic, our Granite State continues to be one of the safest places to live. We're blessed to have tremendously talented, hard-working healthcare workers and competent leadership representing our state.
No question about how grateful we are for those that we know and love across New Hampshire. The first factor we want to highlight is that the elderly are more likely to have pre-existing medical conditions, such as cardiovascular disease, diabetes, chronic respiratory disease, hypertension, and cancer, which unfortunately might make them more vulnerable to the virus.
It's important for us to recognize that many of the elderly living in these long-term care communities have some form of dementia, be it Alzheimer's disease or some other form of cognitive impairment. And this can make it very difficult for them to follow things such as social distancing, wearing masks, or even frequent hand washing.
Additionally, not all long-term care communities have the ability to effectively isolate on an individual basis these residents infected with a contagious virus like COVID-19.
And finally, some long-term care communities are more susceptible to outbreaks from the beginning because they're responsible for a larger number of residents with those high risk factors that Chris had mentioned. It's important to remember that not every community offers the same level of care.
That leaves us with the need to address the solutions, such as increased testing for all residents and staff in long-term care communities.
Absolutely, and increased funding for these communities to allow for increased supplies of PPE, more training and better pay for the staff, as well as alternatives for isolating residents during these outbreaks.
Speaking of the wonderful staff in these communities, we wanted to end with a mention of our recent trips around New Hampshire, delivering some snacks, as well as some letters of love to the residents. One of our recent outings, we wound up delivering 5,000 pounds of bacon to a food pantry. It was donated by Tyson Foods, and if you'd like to see any of those photos, please check out our Facebook page.
We love to give back when we can, and these are just a few of the ways we try to express our respect and appreciation, not only for the talented and dedicated staff that work in our long-term care communities, but the seniors that they serve as well. Thank you so much for watching, and please remember to check out our opinion piece and consider sharing it, and of course send a quick note to our elected officials when you have a minute.
Stay safe, be well, and we'll see you soon.